Thank you, Lawrence. Thank you very much. Excellencies, ladies and gentlemen, good morning, our colleagues in food safety and nutrition. And first of all, thank you, the Pontifical Academy of Science, for this kind invitation of the WHO and this opportunity to speak here with this important issue that we have. It's really very reasonable, and it's a good time when we have this kind of a discussion and different stakeholders about these important issues of the food safety and nutrition. It is the time that the world is changing, and people's diet and their dietary habits are also changing. And they are changing in urban and also in rural communities. And people are increasingly demanding food that it is not a part of their traditional diet or of a higher nutritional value. Unfortunately, this change is often producing a negative health impact, so that unhealthy diets and malnutrition are responsible for most of 1 in 3 deaths globally. And to reduce mortality from non-communicable diseases as well as the maternal and child mortality, we must improve diets and stop all forms of the malnutrition. And the way we stop for and get for food is also changing. Soon, or perhaps already, we will be able to order food online and to deliver it right to our streets by drones. Ensuring food quality is a shifting from local authorities checking products to controls by food producers themselves and accreditation by third parties. Does it mean that food safety will soon be handled exclusively by the private sector? And the answer is no. The governments are still responsible for making sure that the food offered to consumers is safe, as the UN agencies specialize on it. It is WHO and FAO. Governments have also the instruments to influence the food environment and make it healthier by demanding better information for consumers, limiting the promotion of unhealthy food, and buying healthy products for schools and social protecting programs. Food is now traded internationally. And as you know, in 2016, food export was valued in $1.35 billion. And of course, it is a huge number. This shows that we are living in a world where we are dependent on each other. This is clear for us that there is no single country that can ensure food on its own. And that is why the role of the international organization is very important. WHO hosts the Secretariat of the FAO and WHO International Food Safety Authorities Network, and it's called INFOSAN, which plays an important role in detecting and managing foodborne diseases outbreaks that cut across national and regional borders. This net, INFOSAN, responsible a hub of multi-sectoral networks, bringing together public health, agriculture, and trade. Some regions are also developing their own networks that are connected to INFOSAN. Since 1963, WHO and FAO have operated a joint food standards program. The Codex Alimentarius Commission functions as its executive. Codex standards are a key to harmonizing food safety standards across borders such that foods that comply with international standards can be traded between countries without demanding consumers' health. But not only Codex standards helping to make food safer, but they are also improving the nutritional profiles of people's diet, including those of young children. Codex standards are recognized by WTO agreements because member states trust it is open and inclusive process for standard development, as well it is the scientific sound international risk assessments WHO and FAO provide. Also, WHO and FAO are developing a tool to assess the strengths and weakness of the national food control system. This tool can diagnose a country's food system and highlight what needs to be improved. Also, countries can then develop a plan of action and mobilize international and external resources to improve their system. WHO and FAO operate a mechanism, the Codex Trust Fund, to assist some 100 developing countries to strengthen their engagement in Codex. The Codex Trust Fund enabling countries to get support and have stronger involvement in negotiations. This means that Codex standards will become more relevant based on more exclusive data from all over the world and will be used more and will better protect the health of consumers. One of the most important roles for the organizations like WHO is advocate for food safety in the international arena, draw the attention of political leaders to its importance and catalyze the investment. We should continuously scan the horizon to pick up the next challenge for global food safety, and it could be climate change, antimicrobial resistance in foodborne bacteria, or something different. Last but not least, food safety education of consumers and small producers is also an important part. This will drive people's desire and demand for food safety. And this message is known as the 5 keys and has been translated into 87 languages and adopted in more than 140 countries. The WHO 5 keys are an excellent tool countries and civil society associations can use for the World Food Safety Days campaigns, and that should the day officially be adopted by the UN General Assembly soon. And I would also like to point in one important issue, the Decade of Nutrition 2016-25. It is also a golden opportunity to support countries to actions and investment in improving food systems. WHO and FAO are determined to drive global actions to food safety and to ensure that it succeeds in collective international efforts to attain the UN Sustainable Development Goal. WHO is also committed to promoting healthy, sustainable diets globally. We are working with our colleagues in FAO to develop guidelines on healthy and sustainable diets to ensure that people eat nutritious food and that is safe and produced in a sustainable way. In 2 weeks, at the 27th of September, the world leaders will meet in New York for the high-level meeting on non-communicable diseases. This event is extremely important for us, and we hope that we will get the bold commitments from the head of states, who are now we know about 55 head of states who are going to attend it. And this is a golden opportunity for us to raise the important issue of prevention non-communicable diseases for this high-level political level. Yesterday, we heard that 2 general directors of WHO and FAO have announced about the upcoming conference. And today, my colleague from FAO will continue this discussion. I am very happy that it is a great opportunity for us to work closely, hand by hand. And I hope that this upcoming meeting that will take place, one in Addis Ababa and the second one in Geneva next year, will give us a new opportunity of our great collaboration. So finally, thank you very much again for this invitation, and thank you for the opportunity to speak here with these distinguished colleagues.